Welcome and thank you for joining us for a special 1 hour discussion about the ongoing efforts to localize the distribution of COVID vaccines. Joining us for this conversation, we have Whitman Fire Chief Tim Greno, Duxbury Fire Chief Kevin Nord, and Hanover Fire Chief Jeff Blanchard. Gentlemen, welcome to the conversation and thank you for joining me.
Thank you, Kevin. Thanks for inviting us on.
Thank you.
But again, I like to have groups of folks, whether it's the police chiefs, the fire chiefs, your local representation, lawmakers, town administrators. Again, you get to find out where things are going, if there's a unity or if there are issues. The main issue that we're here to talk about is what is going on with the COVID vaccinations, the ability to inoculate residents locally, where right now it seems as though there's a lot of chaos that's going on, or there's been chaos, and hopefully we're going to see things trending in the right direction. I think the best way to start our conversation is maybe doing a little bit of a backstory with our residents as to how long you have each, your communities have been invested, or maybe regionally you've been invested in having conversations with the state about distributing the vaccines. Chief Greno, would you like to start?
Sure, Kevin. That starts long before COVID-19 or the coronavirus, like was ever even thought about. Cities and states across the Commonwealth, through both the fire department and their emergency management departments, have been planning for disaster preparedness and public health emergencies and everything since the Cold War, and the state requires us to have emergency dispensing sites where we can mass inoculate 15,000 residents, like in a short period of time. They require us to train on them. They require us to upkeep them, and we're there. We're at it, and we've done it. There's been millions of dollars spent across the Commonwealth over the years to maintain these sites and to do training on the incident command system and logistics and the planning P and all the intricacies that go along with running these operations. And that's our job. That's what we've been doing. And we've been preparing, and we're ready to go. And for whatever reason, this entire pandemic is not viewed as a statewide, I'd say emergency, gentlemen, but it's viewed as a Department of Public Health pandemic. And the key agency who oversees all of the natural disasters and man-made disasters and everything else in Massachusetts has been left in the back burner. The experts, Mass Emergency Management Agency. And that's where we fall into play. And I think that you'll see from day one with the PPE issues straight up through now, 14 months later, we're still feeling the effects of that improper classification.
But it seems to me as though the state was initially on board, listening to feedback from local towns and cities about doing these localized inoculations. Am I wrong, Chief Nord?
No, 15 years ago, we started the Medical Reserve Corps, which was a volunteer program from FEMA. You might recognize the term CERT, Community Emergency Response Team, as well.
Yep.
And we stood those teams up in anticipation that we're going to be hit with a large disaster where resources were going to be thin, and we were going to have to rely on the community to help us. And that's the crux of those volunteer groups. And we have the Duxbury Bay Regional MRC, which encompasses several towns here close to Duxbury Bay, obviously. And we have a large roster of volunteers that are both, in practice as well as retired, that are skilled with delivery of medical services. And it's unfortunately, it was spun up, spent a lot of money, time, energy, training, quarterly meetings. And these volunteers that want to give back to their community are kind of got a slap in the face because they're not being utilized as intended. Some are. We certainly used them for our first responder uh, in phase one doses. And obviously they're being used currently now over in Marshfield's drive-in clinic. But for the most part, they're sitting idle in these individual communities that have also worked with other communities to spin up for phase two, our 75 plus, 65 plus, and so on. And that's where things seem to fall apart. We were making these preparations as we just came out of phase one with the volunteers, with the fire service, with emergency management, and it kind of fell apart to shift towards these mega sites, and a large population in these communities have that 65 plus, 75 plus with the comorbidities that homebound, not easily accessible. Just take a look out your window and take a look at the weather, and you're expecting someone to drive to a vaccine clinic far away from here. Just doesn't seem prudent. I don't think that was the intention, and we certainly didn't see it coming. So to answer your question, yeah, there's been a lot of preparation over the years to get to this point to deliver a needed service in a time like this. And as Chief Greno said, we're very good at dealing with storms and emergencies, and we just kind of take that all hazards approach all the time. And this is no different than a long-term, nor'easter with flooding and power outages and stuff like that. You manage it, and you throw people power at it, and you dust off your plans, and you execute. And we're kind of frustrated, very frustrated. I'll end on that note.
Chief Blanchard, Chief Broad had mentioned about, each individual community being able to administer doses, whether it was to the first responders or maybe even some of the older population. I would think that you had resounding success in those initial inoculations. Am I correct?
We did. Our local Board of Health has worked with the fire department closely, but not just those two agencies, the school department, the nurses that are there. Literally, like I'll speak for all the towns. I mean, everyone has had to figure out how to do things during this pandemic, whether it's how to hold safe elections or hold a town meeting. We figured out how to move people through lines during the elections, and that's transferable to doing the vaccines. And even though we haven't had enough vaccine to really, need to move people like we did through an election yet, we did do our first responders, like Chief Nord mentioned, and we have done a handful of the elderly as the dribble of vaccine does become available. But we are prepared for that, and like Chief Nord said, we have people that have been thinking that this was coming. I mean, the pandemic's been around. It's been a year now since it was in the news, and we're all kind of wondering if it was going to land here. It'll be March 13th will be the year anniversary of declaring an emergency here. Every single community's had a chance to think about how they're going to deliver vaccine, because vaccine was the end of the pandemic, right? I mean, we've been told that once we get enough vaccine in people's arms, then that's when we can start to get back to normal. So every community, every Board of Health, every fire agency, every emergency medical service agency that operates within a community has been thinking about this. And I know Hanover, we've looked at our emergency dispensing sites. We talked about how are we going to stand this up, and we're prepared to do it. And it's just very frustrating for all of us to sit here and think that we have this amazing machine that's in place. And it may not be perfect. I know, every day we learn something new on how to handle the pandemic. But I think every community would be in a very good position to begin delivering the doses tomorrow if they showed up. And it might take us 3 or 4 days to get it so that it's running really well. But I can tell you, after we were doing it for a week or 2 weeks, we'd be very good at it. And
if I could add to what Jeff said, and to reiterate something that Chief Greno has done as well as Chief Blanchard in these other towns, this kind of started off with the PPE, the personal protective equipment. Most of us only stock a couple of weeks. And then all of a sudden the market dried up, and there was a big movement as we focused on more regional assets as well as state assets and then federal assets. But, for 30, 60 days there, we were all helping each other out, securing PPE by any means necessary. And we did that. So we do deal with that. The next phase of this pandemic, I think, was the ability to test rapidly and to get our firefighters tested. And we achieved that. We went out and purchased on our own, kits that we could directly test our own and send into the labs rather than to stand in line at a Walgreens or a CVS, and not to discredit what they're doing, but to get our people back in service or to put somebody out for an automatic 5 to 10 days because we don't know. We dealt with that, and this is just that next phase of this whole pandemic is the vaccine rollout. And every step of the way, we seem to be coming up against roadblocks at the state level. That's my opinion, and I don't know if the other chiefs agree with me, but here we are again.
Chief Brenna, you want to chime in?
Yeah, I think that there's a couple. Well, I know that there's a couple good points that both chiefs have made. In one of the more prominent factors is collaboration, and the fire service in Massachusetts is well versed in collaboration. We work together every single day, and we help each other fix each other's problems. What you've seen in this pandemic is a great collaboration with our local Board of Health and every other agencies within our communities to muddle our way through this pandemic. And there's no one local Board of Health, unless you're in the city of Worcester or Boston or whatever, that has the resources and staffing that can single-handedly run a vaccination program or a testing program. But in collaboration with the fire departments and the police departments and the DPWs and everybody else, we've built a team over here that yeah, we get it done. They do the registrations, they help with scheduling, they help with notifications, and my paramedics do the vaccinations. And that's how this has worked since day one across the Commonwealth. The only agency that's not collaborating with us is the Department of Public Health. They're more or less dictating what they want to see done, which isn't working at the ground level.
You're just tuning into this conversation. We, of course, are speaking with a couple of South Shore Fire Chiefs, Hanover Fire Chief Jeff Blanchard, Duxbury Fire Chief Kevin Nord, and Whitman Fire Chief Tim Greno. And we're talking about what happened. We went from localized distribution of the COVID vaccines to all of a sudden now there's a push to have these done at mass sites. So I'm going to be blunt here, gentlemen. So what the hell happened? How did this happen? And were you included in the conversation, or did you just get a communique that said, "All right, well, you know what? We've decided we're going to go in a different direction. So thanks for what you've done so far." Does it seem like that's what happened? Is that accurate?
I guess I can stab at it first, and you guys jump in. Several weeks ago, we received a notification from the Department of Public Health that basically stated that there was going to be a shortage of vaccinations in the next couple of weeks, and the plan for that. That was the only official notification that we received. About 2 weeks after that, as we started to put in for our vaccinations each week, our requests were denied. 2 weeks in a row for the past 2 weeks. And that's pretty much the only formal notification that we received up until, what was it, gentlemen? Today's Friday. Was it Monday or Tuesday this week? We received a letter from DPH then stating that local clinics will no longer be supported as of March 1st. And as I previously said, there was no collaboration. There was no group discussion. This is what DPH wants. This is what they're going to do. And no forethought as to what that was going to do statewide to the vaccine operation. That's my thought.
I think, you know, I look at it from three perspectives and again, speaking personally, you know, overall, an immense lack of communication from the state down to us locally. The failure to follow the plan. You know, there was a plan etched, you know, we trained to it, and then the plan kept shifting. The goalposts kept moving. You know, you can't do, you're not going to do phase one if you can't do all phase threes through all three phases. And then it was, well, you can't do, you have to go into a consortium with other communities. We built that up. And then all of a sudden it's like, well, if you can't do 975 doses a day, we're not giving it to you. So it kept, the ball kept moving as we caught up with that ball and tried to make plans for that, it would shift again. And then ultimately it's leadership. Leadership lacks at DPH. They're in a silo, I think. They don't grasp what Chief Greno spoke of, you know, in a concerted effort where we work together with Mass Emergency Management. You know, we've had calls with them and saying, what's going on? How come you guys aren't involved in this? And it almost seems like they've been shut out. And ultimately that resides with the governor. And whether or not he recognizes our plight, we've certainly been vocal enough about it. And I think at the end of the day, you know, we have to stay positive and just keep these plans kind of in abeyance until we get some vaccine and we can start to deliver it. I don't know, Jeff?
I agree. I've been saying it locally that I believe the DPH is operating in a silo. So, you know, Massachusetts Emergency Management Agency exists to oversee, to help manage large-scale incidents statewide, large-scale emergency incidents. And you know, we recognize this is the biggest large-scale emergency, you know, since probably World War II, right? Where the United States felt that it was vulnerable and it prepared its entire nation on how to, you know, be resilient. And basically we shifted from wartime through Cold War to now trying to be more prepared for storms and not having to deal with a Hurricane Katrina and have it go south like it did, you know, during that incident. So we've got a system in place where, you know, DPH could have the leading seat within MEMA because it's their thing. It's a public health emergency, but they operate within that framework, which we've all trained under and been prepared to work under, where we all communicate and everyone knows what's going on and everyone knows what their role is. You know, we're talking about vaccine. It's a scarce commodity that needs to be distributed precisely to make sure that it works. And MEMA has the capability to do that. Whether that scarce quantity is drinking water or shelter or whatever it is, there's a mechanism in place to get that delivered. And I had anticipated, as this pandemic wore on, that we would utilize them to help communicate with the towns and make sure that it was done appropriately and efficiently. And at some point, the communication from MEMA ceased as far as what was going on with this pandemic. And they did a great job and still do a great job of providing us with PPE. If we run short of a certain size of glove or a mask or whatever, I know I can place a phone call and pick that up probably within a couple hours. And they have a warehouse that's available for any community to go to and get those supplies if they run short on them to make sure that we're okay.
And what do they say,
Jeff?
Jeff?
Why we didn't rely on them to help with this rollout.
And what do they say, Jeff? That history repeats itself, right? History repeats itself. And look at our PPE issues 14 months ago, 13 months ago. Everybody was up against it. When several months later, when they finally let MEMA take over the disbursement of the PPE, the floodgates were open.
Right.
You know, one of the things, Kevin, is DPH, you know, is really an administrative regulatory entity. It was never set up or geared, in my eyes, to be an emergency response service. You know, they write the regulations on what we're to abide by, And unfortunately, they were given the main role in this whole pandemic, as probably the law, allows. So maybe we need to take a look at that. Someone's going to write a heck of a white paper if this is all said and done. But when things happen, we all know how to shift gears and how to reach out to that person that's a subject matter expert, and to be able to solve any of the problems. And that's what we do very well, and we do it gracefully, I think. And we've been talking a lot about MEMA when, whether it's a hurricane coming and we're going to have, potential for water rescues, and, we're sitting in the same room with every agency, and everybody chimes in, and that's what's missing in this whole concept as far as I'm concerned.
And if I may just, if I could just interrupt for half a second, we actually have another fire chief who is joining the conversation. If you are just tuning in, we have Whitman Fire Chief Tim Greno, Duxbury Fire Chief Kevin Nord, Hanover Fire Chief Jeff Blanchard, and joining the conversation now is Abington Fire Chief John Nuttall. Chief, welcome to the conversation, and thank you very, very much for joining us.
Hi, good morning, Kevin. Sorry I'm late. I was just leaving another Zoom meeting with my town officials on a different matter. Thank you.
Yeah, so right now what we're doing is we're kind of commiserating over how we got to this particular point. I think the last question I asked was to be a paraphrase, what the hell happened and why are we here? And as your fellow fire chiefs have been kind of, they go back to the PPP situation earlier last year when you're trying to get enough materials to be able to take care of it. And it's like history is repeating itself. We've kind of did a little bit of a, how did we get here as far as the planning, doing the particular shots. I had asked Chief Blanchard about, the distribution. How did your clinics go? And I can jump right in with you, Chief Nuttall. And as I know your community was doing the clinics. Where'd you leave off? Because I would think that you were phase one, you're doing first responders, you're moving to the next group, going to the seniors and helping them. I would think that you weren't able to give a second shot to most of those people who were in a particular phase. Am I wrong?
Correct. We had just completed the phase one secondary shots for first responders.
Yep.
We had begun several of the phase two clinics where they get the first inoculations. It was going very well. And we were gearing up to really start doing about 1,000 a day, whether it be 1,000 a week or 1,000 a day. Not quite sure how many times a week. That was dependent upon how many vaccines we got from the state. But we created the machinery to be able to administer this. The machinery was working perfectly. Now we just needed to open it up more and really kind of throttle that up. And that's when we ran out of gas because the state decided they're just not going to get us any vaccines at that point. We're scrambling now to work with Brockton Hospital and some of the area consortiums to make sure that we have at least enough vaccines on hand for the second dose of those initial phase two people that got it. We think we're going to be okay with that, but we're still extremely cautiously optimistic with that. That being said, to begin any more phase clinics regardless of the phase, like everybody else, Abington's dead in the water because of the Commonwealth of Massachusetts decision to divert all of the vaccines away from the local communities and instead only go to either the mass sites or the corporate drugstores. And there's some other private entities that appear to also have been approved to administer vaccines, but the communities are not.
Very interesting. And you want to say something, Chief Brenner, real quick?
Yeah, Kevin, I think that a good point to bring back up again is what Chief Nord said about we're ready. At the end of the day, kick us while we're down, do whatever you want. But at the end of the day, our residents and our taxpayers need to understand the fact that if I get a shipment of 1,000 vaccines like tomorrow morning, we're ready and we're going to vaccinate 1,000 residents. And for us at this point, like Chief Blanchard, I think, said, we started off with small clinics in phase one, tweaking it, figuring it all out, getting it up and operational. We're ready to do 500-600 a day in Whitman. We we just need them the vaccine. So I think it's a good point that, you know, we're ready. And the reason that we're ready is because of the years of preparation and training and the institutional knowledge and the expertise that we have in emergency management, in emergency operations, that makes us the perfect choice for vaccination clinics.
I think it's worth asking this. You know, when I look on social media, I've been seeing the message getting out there. If you have a chance, contact your local representation, have them call the governor's office, call Secretary Sutter, see if you can persuade them to, you know, change their minds in about face and go back to the original plan. Even so much as last Thursday, I know that Chief Reno and along with Chief Nuttall and other communities actually gathered together and held a press conference asking for that, you know, delivering the message. What was that message, Chief Reno?
The message that we tried to put out yesterday was that your public safety officials, your local board of health, we're here, we're trained, we're able to inoculate or vaccinate our entire communities. The Commonwealth has shut us off from vaccinations and left us dead in the water. And we want you to know that, you know, although mass clinics are their preferred option, it's not the best option for the 75 and plus. And we want to get our message out to the Commonwealth that, you know, we need vaccines and we need to be able to take care of our local residents, because locals taking care of locals is your best option, especially with that age bracket.
Kevin, if I could just add to what Chief Reynolds said, I think the big message I took away from the press conference that Chief Reynolds put together was, you know, we hear you to the public. You know, I can't tell you how many calls we're fielding, not only at the fire station, but the local council on aging, but the Board of Health, with people have reached their limits as far as the frustration with this goes. And we've followed our channels. We've managed it up through our chiefs associations, and they're writing letters. We've managed it up through our state reps and our senators, and they're writing letters. So hopefully that you know, that posture will glean something good from it, and we'll hear that perhaps they'll loosen the strings on the vaccine. Now, I think we all understand too, you know, the weather impacts the delivery of the vaccine.
Yep.
We get that. We understand, you know, you can't move mountains when you have, you know, bad weather extremes, and if there is a you know a less of amount of a vaccine available, you have to diligently, you know, prioritize who gets it next. We understand all that, but that's where that lack of communication comes in. It's not being reported down to emergency management, fire service, and then even in some cases, boards of health.
Yeah, but if I can just say too, the more local the government, the more close impact and drastic impacts we have directly to the residents. And that goes both ways. Local government, whether the fire chiefs, the police, town administrators, board of selectmen, we deal directly with the residents and the taxpayers to either provide them service directly to their homes or to themselves in many cases, to whatever their desire is that they need, you know, as long as we can help them. And the further up the chain of government you go, the further away they are to provide any direct service. But at the same time, I think the least, you know, there's a further disconnect of what the residents actually have. So we're hearing directly from our residents what their needs are. You go up a chain of command to the representatives and the senators, the local ones, they're also hearing from them, although they may not interface as directly as we are. You go up another chain of that command to the government, the gubernatorial layer.
Executive.
They're now getting layers between the actual resident and them. And you keep going up that chain up to the president. And I think the disconnect is drastic. And we're really seeing that. We're seeing that on a day-to-day, and it's very emotional, and there's fear in there because the residents want to be told that, you know, they're being helped. I think that they understand that there's a lack of the vaccine and availability. Although if you divert some of the vaccines, like we said before, directly to them, we can at least take care of some of our most vulnerable. We're not going to be able to take care of the whole towns. None of us can. We understand that. And there is a need for the mass sites. There is a need for, the other local clinics, how they're run, because everybody has their choice. We're not trying to tell everybody you can only go through us. We're just trying to offer that one missing piece to our residents that we see directly, that I think higher levels of government, that they're just not seeing that, or they're not understanding that.
Chief Blanchard, did you have a comment?
Yeah, to build on what Chief Nuttall just said, is our communities know what's going on in our communities and know our people. And so every community in this state has learned how to work together internally. The departments are working together. In Hanover, for example, we meet every morning at 9 a.m. We have a Zoom meeting with department heads under emergency management. And we just touch base. And those meetings at the beginning of the pandemic were long. Now sometimes they're only 5-10 minutes long because we kind of got everything kind of under control. That's how well things are going. So when we started transitioning from how to get people tested so that we could help them manage getting back to work if they were quarantined, we kind of had that under control. We started shifting to what's going to happen when the vaccine rolls out. And our school superintendent said, whatever I have to do, if I have to go help deliver the vaccine myself to help make things better and get this world back on track, he goes, I will do it. We've got to, that is the priority. We've got to do that. And in Hanover, I mean, we have a mobile integrated health program. We've been working with the school nurses, with facilities department, with our DPW, with our police department, with our community services department, with our Board of Health, obviously, and the fire department, everybody. And if I miss a department, I apologize, but we have all been working together to make everything happen. Whatever the problem was, we talk about it, we figure out a solution, and we do it. And we are all prepared to deliver this vaccine efficiently to our residents. We just need to be part of that plan. And we are just astounded that we're not being included in it. We're not being part of the solution. Our solution is get in your car and drive to Gillette, or get into a queue at midnight so that you might be able to go to CVS and get a shot. And your chances of getting that are as good as, winning $10 on Powerball or whatever.
Well, a good example of that, is 3 months ago, it might have been 6, but we all received regulatory, lifting of a guideline from DPH, which under that DPH is Office of Emergency Medical Services, which we all comply with and have it licensed to operate ambulances and paramedics. And we were all sent notice that paramedics can give vaccines. Heck, basic EMTs could give vaccines. So, I mean, there was a plan, and they communicated that. And then here we are today, and the plan shifted again. Like I said, they moved the goalposts. Like, we're not going to give you the vaccine, even though we're allowing you guys to do it through regulation. So that's frustrating. So, as you look at all these dribbles of communication, and you see us going in a direction, we're all gearing up for it. So then we send all our paramedics to special online training to give either the Pfizer or the Moderna, and we invest in those people to gear up and get ready. All to find that no, we're not gonna do it this way. We're gonna do it another way.
One of the things I heard from my staff, from our residents, and to follow up what Chief Blanchard just said about the schools being involved, we had the same thing. We literally had the Abington school superintendent and his staff were staffing the registration portion of these clinics as the residents came in to help register them, and all hands were on deck in Abington. I think we're seeing that across the board. All of the local governments looking to do that. And like Chief Nord said, we complied with everything. We followed all the rules. This literally changed overnight. One of the things I kept hearing from my residents and from our staff that were doing it is, for the first time in a year, we felt like we were able to go and be offensive on this pandemic. We're actually kicking back for a bit, punching back, I should say. And the enthusiasm was great. And the optimism was building, the enthusiasm was building. Literally overnight, this changed. And in fact, I was at one of my clinics when my health official received the email that his request for, we thought we're going to be doing 1,000 beginning the next week, went down to 0. Everything, it literally stopped and it's dead in its tracks. You know, I haven't seen our residents get this optimistic and enthusiastic, and then suddenly just the rug was pulled out from under them and then turning into anger since the 1986 World Series with Bill Buckner. We have screwed this up. Well, they have screwed this up so bad that we have in New England, we know what that means. In Massachusetts, we know what that means. I'm starting to date myself, but anybody that was around at that time, what an awful comparison to have this administration be compared to Bill Buckner losing the 1986 World Series when it literally just went right past them.
You have
And
to
that's
stop picking on
exactly
Bill.
where we're at with this.
You know, John, you're talking about the 86 World Series, which most of us remember. Jeff was talking about World War II earlier, which I think only Andy Reardon would probably remember.
Again, if you're just tuning in, we are speaking with local fire chiefs in regards to trying to get back to the efforts of localizing the distribution of COVID vaccines, as it has been reversed in the state is trying to push residents to go to these mass sites to get inoculated. We are joined by Abington Fire Chief John Nuttall, Duxbury Fire Chief Kevin Nord, Hanover Fire Chief Jeff Blanchard, and Whitman Fire Chief Tim Greno. I have to ask you, we're sitting here now in retrospect. What's taking place now, things could change in the next couple of weeks. We don't know. Could this have a long-term effect on your departments and your relationships with the state? Not just your departments, but your communities and their relationship with the state and the trust factor. Jeff.
Absolutely. I think it's, you know, we advertised and advertised for and held training sessions for CERT members to make our town more resilient, because we knew that people would have to rely on themselves in a large scale emergency, maybe for hours or even days before more help could arrive. And we tell them, you know, that this, you know, when something like this happens, we're gonna use you. We want, come attend this training because we're gonna put you to use. And you know, we have people that are really good at setting up shelters, and we train with them and we prepare with them. And when we have a long-term power outage or there's a large storm and people need to use that shelter, we open it up and they get to use it. So it's going to be very difficult, I think, to encourage people to come prepare and train with us to do these an emergency dispensing site in case we ever have to inoculate people against a bad disease. And they're just going to say, yeah, like, what's worse than COVID-19? And if you're not going to use us for that, when would you ever use us? So I think the answer to that is yes.
You know, to echo what Jeff said, Kevin, you know, I would just take it a step further and again go back and reflect on what I mentioned earlier in this interview, if you will, meeting, is the volunteers. There's so many volunteers that make up the Medical Reserve Corps, and again, you know, in order to keep someone, you know, gainfully, you know, within the system and want to come in on his own dime and train up, is the hope to be utilized to give back to the community. And when that's not done, the ramification of that is probably less volunteerism, and that'll affect us, because this is not going to be the last pandemic. This will be a new thing that'll probably roll out over the next 10 or 15 years, and we'll always be dealing with something, another, you know, tool in the toolbox on how we handle it, obviously. But yeah, the volunteers, I you know, I feel for them and appreciate all that they've done, and we've got some really great volunteers, spent countless hours of their own time. You know, what has to happen, just so the public's aware, you know, you can volunteer for an MRC and you go to the federal website. Well, someone locally has to take your name and then Corey and Sori you, and then spin you up with some initial training on how a vaccine clinic works or how a shelter plan works. So there's a lot of energy, a lot of time, effort spent. The two gals that are doing it right now are answering almost 90 emails a day, uncompensated. And they're putting their name to that, you know, authorizing someone to go into a clinic to vaccinate. And, you know, we're scurrying around trying to figure out a way to pay them moving forward, because they should be compensated for all that time and energy, especially at that bulk of what they're doing. So the volunteers, I think we might see less volunteerism in the future.
Kevin, I think your question, and I'm going to really try to stay on point on this, but you've opened the door that this really could go anywhere with that question is, do we trust the partnership with government? And agreeing with Chief Blanchard from Hanover, yeah, I think there's damage that has been done that really does need to begin to somehow be healed on that. And the damage really, it's the disconnect. And as I said before, it starts at the local level, and the further you move up, I think there's just a general distrust in lack of confidence in government from most people, regardless of the political party. I'm not getting into politics on this because I think both sides are guilty on this. You know, we're trying to keep it at the local level, but we can't do what we're able to because of a decision that's made at a state level. And as I said yesterday, I think it's time to start asking questions. Well, why were those decisions made? I'm not going to get into that now, but I think that opens the door to it. That further opens the door to when you move up the chain of command to some of the national decisions being made. And we just passed, or we saw passed 1.9 or whatever the figure, $1 trillion coronavirus act package, whatever they named it. And when you start looking at what else was hidden in that, and billions of dollars going to other nations for God knows what, there's a disconnect. And I am going to bring this back to the local level, but it's a general disconnect and distrust of government, all under the umbrella of COVID and CARES Act and the coronavirus. And there's massive decisions being made. There's massive money being transferred from what, you know, I'm not going to get into where some of the money went in other countries. I have no idea how that's tied to COVID, but it was under the umbrella of that. When you bring that back down to the local level, and the people that we see, the average American, whether they're living in Abington or Duxbury or Brockton or Cohasset or California, people are seeing this and they're really starting to question what the hell is going on. Who do we trust? And we as local officials that are trying to just provide emergency service and care, we're kind of under the shadow of that. And people start questioning, you know, what's going on. And I think the more local you get, the more transparent you are, because you have to. We're responsible to our very own neighbors,
Yep.
literally, whom we're providing service for, and they're paying for that. That disconnect has got to end, and we really need to start somehow bringing things back to reality from the top all the way down. We're seeing an impact of that.
And Kevin, on that topic, I don't want to say benefit, but I think where we have our arms around the trust issue is you go back to that collaboration at the local level. You've got Abington and Whitman and Hanover and Duxbury and East Bridgewater's. All of our Plymouth County towns are working hand in hand at emergency services level. And when I get bad news, like from the Commonwealth, I'm advertising what the Commonwealth is doing, as is Abington, as is Hanover, as is Duxbury. So our residents know that we're being as transparent as possible. And as we're talking, I'm scrolling through a bunch of emails that came in this morning. I've got 7 or 8 emails just from yesterday's press conference alone from residents thanking us for standing up for that local resident, because they trust the fire service. They trust us. They don't trust bigger government.
It's funny you say that, because the one thing that I've learned from my years in media is when it comes to the fire service, when it comes to your manpower, if somebody is lonely, they don't call the police station, they'll call the fire department, for a well-being check. If they need an air conditioner put in, they don't call the DPW, they'll call the fire department. They count on the fire department for so many different things, and that's not to diminish any other department, but I identify and know from things that I've covered over the years. So it's interesting that you share that tidbit. And when we talk about trust, the one thing I would ask you, we're hearing the reports that there's still ongoing issues with the website to be able to sign up, to be able to get a shot. The governor recently made a comment that he's pissed and he's going to fix this.
Can you say that on TV?
Yeah, you can. Yeah. what's interesting is has it gone to a point where the state is realizing that maybe they shouldn't have done this, but they don't know how to reverse and go back to what it was because it could be a source of embarrassment for the state? Is that possible?
I think this goes back to, we need a dialogue, not a monologue from the top down. We need a dialogue to go in both directions. And neither side may not want to hear what the other side says, but that's how we solve problems in this country, or we used to. We need that dialogue back and forth so that they're hearing from us, we're hearing from them, and not just a monologue coming from the top down saying, thou shalt, without any explanation, because maybe, sometimes we have different ideas than they have, and they just don't know that. Obviously they're going to know things that we don't know. We understand that. But we need a dialogue to discuss these, to correct them.
And that dialogue will help us provide answers. We're all accountable to somebody. And we've been directly accountable to the residents and understand their needs and know what they are. And it's easier for us to explain to them what's going on in a more global level. If we have that give and take, like Chief Nuttall just mentioned, but we haven't been getting that, and that's been part of the frustration. And I think, just to close out, I think all of us as chiefs with this vaccine, we really wanted to get it to our the phase 2 A and B group, the 75 plus, the 65 plus, the infirmed, the homebound, potentially the low income. And service them because they can't travel in this type of weather. They have obvious health issues and I think there's a physical inability to do that, and then I've said that there very well could be a psychological inability to do that. They just don't want to venture out that far. So the phase 3, the general population, the healthy population, I think can go through those mass sites, but I think locally we need to get that vaccine for that first part of phase 2.
Chief Blanchard, did you want to chime in?
I think he's muted.
Chief, I think you're muted, sir.
I had some background noise a minute ago. Sorry. I think the word dialogue is very important here.
Yes.
As it stands right now, if you're not able to catch the governor's news conference, you're not up to speed with what's going on, right? And that's great. And I think that's when we talk about the word transparency as a buzzword we all want to use out there, it makes government transparent, right? But those that have to react and be able to work with their communities and help put these things together where the rubber meets the road, it's very difficult, I think, for us to work that way as those that are leaders within the community that are responsible for delivering the service, to have to react to a 12 o'clock press conference and make decisions on the fly is very difficult. And I think it would be helpful if a clearer picture was being painted from the top on down as to what we could expect. And maybe there is a plan to ultimately put vaccine in the local town's hands. But if there is a clear plan to do that, it hasn't been articulated to us yet. And I think that's important. I think it's this lack of communication that's the overarching theme here that needs to be addressed.
We get about 7 or 8 minutes left in our conversation here, and I usually try to reserve that at the end of a conversation for anything we haven't had a chance to discuss. Maybe a pertinent point to be able to kind of wrap it up and maybe put a positive spin on it. I know it's kind of tough to do. Is there anything that we haven't touched upon during our conversation that one of you gentlemen wants to, or all of you want to take a chance at talking about?
Yeah, I think our residents, and I think your listening group just needs to know that, we're here and we're ready. And, my glass is half full, and I have to think, I know that the governor is a smart man, and there's time to make some mid-operation operational change here, and our residents just need to know that we're here for them and we're ready, and once we get the green light, we'll be vaccinating again. And if there's anything that we can do for them in the meantime, as they've always done in the past. All they need to do is reach out to us.
Chief Norton?
Yeah, I just, echo that as well. And I know the sun's going to come out today sometime. And that, we're ready, and we're going to stay on this and continue pushing back on, our state reps, and try to focus some conversations with DPH and the governor's office, and just continue to work this problem,
Chief Nuttall?
I think over the last year, all of us were really beginning now to feel the effects of the COVID, just the fatigue, dealing with all the daily things all of us have been dealing with. And each time there's been a milestone, if we can just make it till this point. It started out, we're going to make it 2 weeks, and then it's going to go to this. And then if we can get to this point, and then if we can just start wearing the mask, and we're going to shut down this holiday. And we keep going to point A to point B to point B to keep going. We're breaking it up into small segments, ultimately to get the vaccine, which hopefully could end this. And that's what's happening now. We're at the point where the vaccine is here. It's not in abundant supply, and everybody really wants it to be, all of us included, so that we can hopefully get to the next step to maybe begin ending this and getting back to reality. And I think that's why we're at that nexus right now, that everybody's at the point we've all been told we've been waiting for. And there is zero patience from people to see anything go wrong with that, because they want to move forward with their lives. We understand that. It is going to get fixed. Ultimately, it's not going as fast as any of us want it to be, but that's a reality. Like Chief Nord said, the sun is going to come out. We're strong Americans. We're going to get past this. And I think right now, it's the month of February is always the worst month for everybody in New England anyway. Thank God it's the shortest month, because it's the worst month weather-wise. And I think just everybody wants to get moving on this, and we're all getting somewhat impatient, and we really don't want to see anything slow this down further than we've already been slowed down for the last year or so. We will get past it. We're going to somehow make sure everybody that wants the vaccine will get it. It's not coming as fast as we'd like, but we are trying. We'll get through it.
Chief Blanchard?
I think Chief Nuttall did a nice job of kind of wrapping that up. I'd like to just maybe add a thank you to all of the residents of our communities, and of every community basically, who have been so patient and done their part, and particularly to recognize the volunteers who signed up with their local communities. Hanover had over 200 volunteers that offered their areas of expertise in every way, shape, or form, during this pandemic. And right now we've got a list of 85. I was just looking at it, counting it, like 85 residents with medical training that are willing to come and help out at a vaccination site, once we're ready to stand it up. And that's just, Hanover's a community with 15,000 people. So to have 85, residents with medical expertise put themselves out there to help us, it's just, a snapshot of what's going on in every community. So I really want to thank everyone out there that's reached out to their communities and tried to be a helpful part of the solution in the response, and for everyone that's done their part in helping stop the spread. And like Chief Nuttall said, we'll get through this.
Yeah, I think the important part, and I think you've all said it in one way or another, is it's going to take time to gain herd immunity, and for us to get the shots up, it's being patient. Chief Brennan, I want to thank you for being the conduit, being able to connect.
With a conduit.
Being the guy who connected us with all these other chiefs, as you always do. See Chief Nuttall is laughing. Do you want to say anything?
I've heard Chief Brennan.
I've been called a lot of things, Jeffrey, but not conduit.
I was just going to say, that's probably one of the more kinder things I've heard.
We'll call him the condor.
He swoops in. But I want to thank you all for taking time out of your busy schedules to discuss this important topic, this issue, because it is very important. And if we can use any form of medium or media to be able to get the word out, it's appreciative that you're able to channel it through myself and the multiple sources that I'm able to get the word out through. So I definitely thank you all.
Well,
Thank you, Kevin.
Thank you, Kevin, for doing this, because you have been very kind to us in the past about coming on your show, and I think it's important. So thank you.
But the only thing is that usually when we have you on, we get a chance to really drill down into what the fire service offers and what you guys do and the brotherhood, the sisterhood, and what you're able to provide, and even the tough times. I mean, again, when you're trying to put your budgets together and trying to tell people, hey, there's a reason why we're trying to upgrade our equipment, or we're trying to build a new fire station, or we're looking to add to our membership when it comes to certain volunteers. You know, I enjoy those conversations more. This conversation we had to have today was, it was a little bit more tougher because, you know, you really don't want to put anybody on the hot seat, but I think people need to know that you know, that the communities have been doing their jobs, whether it's the fire department, the health department, the public schools, whoever has been helping to kind of lead the charge to be able to inoculate our citizens. You know, again, I think it's important that we're able to at least shed light on that. So again, I thank you for your time.
Great.
Thank
And if I get calls for putting in air conditioners, I'll make sure I call your cell and you can come down and give me a hand.
Good call. All right. And again, thank you very much for tuning into this conversation we had with South Shore Fire Chiefs in regards to localizing the distribution of COVID vaccines.